I would love to start off with your story, your background, how because you two work together, correct? And your husband and
Yeah.
wife. That's pretty darn cool. So yeah, you can start us off with your story.
Okay. Well, look, your good husband's gonna let me start. He's
Oh.
like, "That would be you, honey." So, back around 2000, so 26 years ago, I was hired to replace Steve, who was going back to Canada in Portland, Oregon. And so that's how we met, and he was training me. uh, just how to use herbal formulas. And I just had some amazing cases. In fact, one of the cases that really opened my mind to integrative medicine is a formula we're going to talk about with heart disease because it's just so good for the chest tumors, heart disease, all these things. But he was definitely very informative and super cute. And we fell in love, and they lost us both. It was a very good-natured clinic owner, hospital, it's a big hospital,
Mhm.
lost us both, but, and then we went up and started, Edmonton Holistic Veterinary Clinic, which was Steve had actually gone to Portland because he got his naturopathic degree. So he is a naturopath, a human acupuncturist. He got his master's in Oriental Medicine, which is Chinese herbs, and, was treating both people and animals.
Wow, that's really cool.
Yeah.
All in the same building, which was kind of a
All in the
rarity.
same building. Yeah, that's so
Yeah.
rare.
Yeah. Yeah.
How
They
did you pull that off?
we had, we had to get, licensed by
Yeah.
multiple regulatory bodies, the Alberta Veterinary Medical Association, Public Health with Alberta, the
Uh-huh.
Naturopath Association. Everyone had their 2 cents. The only thing they made us do was put a low wall between the 2 waiting rooms and a gate. But oftentimes, the owners the human patients wanted to go sit with the animals. So everyone wound up oftentimes in the same waiting room. And yeah, we had front desk, and on one side of the front desk are the animal exam rooms, and on the other side of the front desk were the human exam rooms. Eventually, the veterinary clinic got big enough and busy enough that I had to move the human clinic across the street after like a decade or 15 years or something.
Mhm.
So it was a very nice space with burbling fountains and somebody aromatherapying somewhere and soft music playing but all people would say is, "I really miss the click, click, click of dogs walking up and down the
Yeah.
hallway."
I feel like that would be excellent for integrative medicine, because you have
Mhm.
therapy dogs. I actually know somebody that does therapy mini horses, and she has one, and she brings it into the hospital. It wears little boots and everything, and she brings this mini into the hospital to hospice care patients.
Oh,
And
that's awesome.
it's made it's really, really neat how much of a difference it's made. So that's really cool. So
Yeah.
Yeah.
you no longer have that clinic?
So we had that hospital for about 20 years and then sold it to an associate who worked for us and just decided to kind of switch it up. The timing was unknown to us, perfect because we sold that hospital March 1st, 2020, and 3 weeks later COVID hit. So
Mhm.
uh, it's kind of that was an amazing adventure, and it was the largest integrative hospital in Canada, and as Steve was saying, treated whole families, He always says, people are easier than animals
Yeah.
because they
Mhm.
tell you what's going on, "This hurts," or, "I feel like something's
Right.
stuck in my throat," whereas the dog's like, "You
Yeah.
figure it out," or they're "Someone's gonna save my heart," or,
Yeah.
but, but then it gave us this really nice transition into because we've always done different things. Steve worked in zoos. He was a vet for Toronto and Calgary Zoo, and he was in Southern Alberta, and they only vet for 400 miles with the horses and on the reserves here, and pulling calves in -40, and then integrative medicine and human medicine. And I think that's what's so fun about
Yeah.
our profession. So we had a change and started doing more telehealth,
Mhm.
education, trying to recognize that we're down so many veterinarians. It's like
Yeah.
46,000. The holistic veterinary community is
Yeah.
tiny. So trying to get out to the general public, things like this podcast are so important to veterinarians and veterinary medicine. Not that we don't want to educate vets, but they're a smaller part. We really need to share this because we are at the tail end of our career. Steve is winning prizes for like last vet standing in Alberta here at 38 years. It's like 2 of them left.
Oh my goodness. It is very scary, the lack of vets that we have. And when I was originally in school, I did animal science and I did equine studies and I wanted to be a vet. And then I applied to UGA. And after interning with a couple vets, I was like, I
Mhm.
don't know if I want to do this. And
Yeah.
maybe it was just the people that I interned with. I interned with a couple equines and then a couple small animals. And I don't know. It wasn't for me. And so I went and did integrative nutrition. And then I circled back and now I do animals and no longer people. But I'm always kind of kicking myself. I'm like, should I have just gone? Because I can't even find a vet here. I think I have like 2 equine vets in my area and they are solid booked. And then I
Yeah.
have 2 like vet clinics. And then the one just stopped taking clients because they're like, we can't take people. And I'm like,
Yeah.
It's a really big
It's
problem.
yeah, it's an epidemic issue. So,
yeah.
um, so for years I mean, Karen and I literally wrote the books on for veterinarians about how to treat or how to use integrated medicine to, treat almost everything that comes in the door. And my hope was that somehow that holistic medicine in veterinary medicine would just take off. But,
Mhm.
over the past 30 years, it just really hasn't blossomed the way I'd hoped. So now, people are in your position where sometimes they don't have access to regular veterinarians, or most of the time they don't have access to holistic medicine. And so training veterinarians to deliver that is fine, except that if the veterinary profession is dwindling and
Mhm.
holistic veterinary medicine with it, then we need to start educating the public directly. And so that's kind of what is the hallmark of this last phase of
Yeah.
the last 50 years of our career.
But the
And
public is, yeah, it's so important. Like
It is.
to
Yeah.
segue to real food or heart
Mhm.
disease, there were 2 things that we really learned so much from our clients and from the public, even before cell phones, which was a reality for us. Like we were the vets, we're like, go to the library. There wasn't any internet. This idea of real food. Like when we moved to Edmonton in the first 2 weeks, somebody walked in the door with a bunch of raw food and was
Mhm.
like, oh, you should try this. And I was like, Steve, someone just brought a dead
Yeah.
moose. And I kid you not, it was a moose. Like the
I
moose.
believe it.
welcome to Canada.
And I
Yeah.
was in Boston anymore. But it was them pushing us forward. And there's
Huh.
a story we've told many times is that, I had a older Dalmatian. She had hip dysplasia. She had liver problems from overdosing on drugs when she was young. And she was 10 at the time. And I had a kind of anorexic rescue greyhound who never ate properly. And I said to Steve, I don't know. I'm going to try this raw food stuff because
Yeah.
her cups looked really good. Steve was like, I don't.
I mean, all I'd seen so far of raw food because it was still not a big
This is
thing.
2001.
I had
Yeah.
just seen a bunch of animals get sick on it. And
Mhm.
so, like your average conventional veterinarian, I
Mhm.
I was like, "Are you kidding? You're gonna feed raw food?" It's like, "This is gonna happen, and this is gonna
Yeah.
happen. They get sick from
Yeah.
this, they get sick from that, and blah, 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 blah." And Karen, bless her heart, is just standing there looking at me, faint smile on her face. And after my rant had run out of steam, she looks at me and she goes, "Okay, well, just so we're clear, we're gonna do it anyway."
We're gonna try it anyway.
Yeah.
And thank goodness, because
Yeah.
it's not for every dog, but it's probably
Right.
for many of them if the diet is well constructed, and
Mhm.
it just reverses so much pathology.
And and I think it was such a tell for our careers because you learn a lot of things. And on the internet, there's so much information. But for us, we have had to sift and sift and sift. Why did he have a bias? Because Chinese medicine doesn't like raw, cold food. They like
No,
soup
they
and
yeah,
stir
right.
fries. And when
Mhm.
you have an old, cold kitty cat,
Mhm.
you don't give her raw food. She's not going to eat it. So it's when we, like as an emergency vet, I saw animals sick on raw food because the owners did it at maybe the wrong time. But
Mhm.
for like a hot metabolic, like a dog that needs raw food, it'll save their lives. Zoe lived to be 15 and a half years old. The greyhound was 16. They had just the tail end of their food on raw, but it extended their lives. Is that for everyone? No. But it's just like anything, like the things we're going to talk about today. It's like, of all the heart formulas in Chinese herbal medicine, which ones work for animals? Like, what is
Mhm.
the stuff that actually works? So it takes time and decades and,
Yeah. I think that
figure it out.
the research you had to do was more beneficial because I come from a Western herbalism background and I started, studying TCM probably like 4 or 5 years ago. But the clients that I had, they're like, "Oh, herbs don't work." And I'm like, "Well, because you're treating it like allopathic medicine. You're not matching the herb to the constitution, right? It's the tissue state that we're trying to treat." And so I started seeing that happen with clients that were trying to use traditional Chinese medicine. They're like, I'm trying to follow this because I Googled this and it doesn't work. And I'm like, well, research is so much more deep than just going onto Google
Yeah.
and clicking on your first three sites. So, like, you two having to go through books of research, I feel was probably a little more solid than today when it just like shoots off two or three websites. Like, you still Google garlic and it's like three websites that say you're going to kill your dog. So,
Yeah.
like,
Yeah,
so
the information out there still needs to be improved.
it,
But
it,
So,
garlic is that's a great example
yeah.
because we are taught as veterinarians and but it is the state of the animal because I
Right.
will tell you, one of my first blood transfusions I had to do by myself was a boxer who ate onion rings at a ball game
Oh,
and could maybe another dog eat onion rings and be
mhm.
okay. Yeah,
Yeah.
but that one wasn't.
Yeah,
So
that wasn't. They're
how much
individuals.
weight was sitting there? What had the dog had a bunch of vaccines eating kibble? Like, I don't
Mhm.
know. It did. This is back in the day when I was like,
Yeah, no, I completely understand. Well, I would love to get into speaking about heart disease because I have to say that is so close to home for me. I When I got together with my husband, he had 2 beagles, and surprisingly, they lived till they were, like, 13 or 14, but they both passed away from heart disease. So when we got together, he grew up giving the kibble that you buy at the ag center, and so when we got together, I was like, "Ooh, let's, like,
right.
try to incorporate some fresh food." And when we did incorporate fresh food, they blossomed, but they still ended up, passing from heart disease. I think we're just at the tail end of it. So
Mm.
I would love to learn more about what you guys
Yeah.
have to say.
Well, diet's a great place to start because diet is kind of what really, in a way, it's diet that actually brings on heart disease. People are used to thinking of that for themselves with cholesterol in their arteries, but that that is actually not what I'm talking about. What I'm talking about is there's, I mean, most probably 70% of adults in North America take blood pressure lowering drugs. Many times they don't work, but yeah, it's about that percentage in North America. So there's an endemic issue. MDs call it essential hypertension, but it's not that. It's actually a diet induced constriction of blood vessels that is independent of the mechanisms that your body has to regulate blood pressure. It's caused directly by, a state of overnutrition and too much food coming in too quickly. So, what's the antidote for that? To
Mhm,
this vasoconstriction? It's food coming in much more slowly and in
mhm,
smaller quantities, and real food diets with their higher moisture content, their higher fiber content. Animal has to work harder to get the food in. That is, it's may not reverse heart disease as you found out, or it may slow it down, but it certainly does kind of rip the rug out from underneath it and give us an opportunity to then step in with other therapies that
mhm.
that can then take something that is slowing and either stop it or else have it actually revert.
yeah. And I mean, I always remind clients that the heart is our biggest muscle. And everyone always talks about getting enough protein and all this stuff. And when you're feeding really processed foods, you are not helping that big muscle. And one of the most fascinating things as an integrative vet, and I think it puts a smile on every integrative vet's face, is when we have the imaging. I love the imaging. I understand everyone can't afford it. You have the imaging before, and then you've changed diet and given things that help the heart remodel because we all know your arm, like my arms, seriously, if I just don't do anything, they just look it's so pathetic. and I have to really work. And they go back. They go back. Your heart can go back. And then we have had multiple cardiologists accuse the owner of bringing a different dog because the
Really?
heart has remodeled in such a positive way. And that is not always the case, but when it
Right.
happens, it is fantastic. And it should make sense to everyone that our muscles don't just get destroyed and then blah. You can rebuild and help your heart muscle. Absolutely. We know this.
Yeah, that's actually an excellent point because you had talked about how it's getting harder to get into vet clinics. And we sort of just have this default assumption that if you just get in there, you'd be working with cutting edge
Right.
college, cutting edge therapies. It's actually not true. There's a lot of research that has been done that has not been incorporated into veterinary medicine just because there's no pill to
Right.
kind of capitalize on it. So Karen's alluding to one thing, which is we were both taught that, when your heart, you see the enlarged heart in the x-ray, the veterinarian probably explains it as, well, it's not pumping as efficiently. So there's more blood in there at the end of each beat, and slowly it's starting to stretch the heart. I would bet that any veterinarian watching your video up to this point would go, yeah, that's right. It's
Mhm.
not right. As Karen just said, the heart is not just passively stretched and blah, as she calls it, like her extremely muscular forearms.
No, no. I
It's
just went around for a reason.
the heart is actively remodeled. The body deliberately makes it a big saggy sack of blood. If you can interfere with that mechanism, that heart resumes its normal shape. And so the first time this ever happened to our patients, we couldn't even believe it ourselves. But we had started off with abnormal ultrasounds. And as Karen said, ultrasonographer comes back. They accused us of replacing the animal with somebody else and saying
Yeah.
this is not that patient. It's like it is. It's like, it can't be. The heart's normal. So this
Yeah.
idea, yeah.
Yeah.
So that needs some extra help to do that.
Yeah.
But it is possible for sure.
Yeah.
Yeah.
Yeah. And I think there are so many common, easy things that people can get a hold of. And just going back to like when we had our practice, one of the things I've always done is house calls. And the reason I've always done house calls is not really geriatrics or whatever, it's heart disease. So we had lots of patients who had been in oxygen at emergency hospitals and would turn blue from the car ride, like, or any kind of stress. And I absolutely forbid them to ever come to a veterinary hospital. Even our Zen, like we've got, it was a very pretty, quiet hospital. Doesn't matter that dog's already stressed out. So those animals really need to have house calls. And in addition, there's so many things that people can access themselves without going to a hospital. It's good to have veterinary guidance to actually know what's what, but it makes a big difference.
I
Mhm.
never thought about that though, of when you stated that it was almost too much nutrition coming in. I
Yes.
really, really never thought about that because when I think about it, I think, well, his beagles were on kibble, kibble is extremely drying, et cetera. And then I kind of, go down the rabbit hole, but that never crossed my mind that,
Yeah. No.
nutrition need to be slowed down. And
When
it's
you
just
get too
that.
much going in too fast,
Right.
any high density food, the
Mhm.
body's gotta deal with it. It's like, "Okay, we're really busy and I gotta do this and I have these other jobs now because there's so much coming at me." And
Mhm.
what happens is a word that most people know, free radicals.
Right.
It's part of life, but they are troublemakers, right?
Mhm.
I go to the beauty counter, they're like, "Let's take care of those free radicals."
Yeah.
But it's just part of life. So if they aren't being dealt with because you've just
Mhm.
thrown too much crap at your body,
Yeah.
those free radicals are not helping Mr. Heart,
Mhm.
right? So when you have real foods, you're eating things like that, things are coming in slower. That the animal is designed to eat them, can
Right.
absorb them. You're decreasing your free radicals because your body's dealing with them instead of being sidetracked with all
Mhm.
this stuff.
Yeah.
Oh, it makes
The
sense.
exact connection is that there's this compound in your blood vessels. It's supposed to be
Mhm.
just lining your blood vessels called endothelial nitric oxide. The name's not important, but it's supposed to be this substance. When the substance is there, the vessels dilate. And Humans don't have hypertension. Animals' hearts aren't trying to pump against, heavy resistance. The free radicals that Karin's talking about, what they do is they come and wipe out this compound inside the blood vessels. So then the vessels constrict, and then the hearts are having to pump that much harder. And you set in motion these events that cause congestive heart failure.
You know what? One other thing that's cool about that is that people who eat the dogs are eating the kibble, right?
Mm.
And everyone's worried about their dental disease because
Yep.
just like in people, the bacteria seeds into the bloodstream is going through the heart and that affects the valves. And so vets are like, oh, you've got to, have a dentistry, then that's scary because maybe the heart isn't stable enough. But if it
Mhm.
is, they're not helping the teeth by giving all the kibble because it creates the carbs or sugar and that creates all these problems. And then unfortunately, a lot of regular vets will give like a cleanser that is like a mouthwash.
Mhm.
So the really important thing about this chemical, nitric oxide, we'll just call it
Mhm.
No's in there, and he's gonna make your heart and your vessels stay nice and wide and healthy. It works with bacteria. So bacteria in the dog's mouth is really, really, really important. The bacteria in our mouth is really, really important to our own heart health to keep nitric oxide levels healthy. It's a huge part. So if you kill the bacteria in your mouth or a dog's mouth with mouthwash, you're actually accelerating the heart disease.
Right,
So
so they're
it's a
wiping it
really
out.
random little thing, but I would warn people, anyone with a dog with heart disease or yourself, do
Mhm.
not use mouthwash because the bacteria in your mouth is part of a really important way of keeping your arteries open.
That's
And
very
when
fascinating. I've
the
never learned that.
I'd
yeah,
never heard that too.
and when you
Yeah.
She's
eat
full of
when
ideas.
you eat real food, your teeth look better,
Yeah. Oh,
teeth
yes.
so much better. Like, that's the first thing about raw-fed dogs. I was like,
Yep.
"What? You were 11? Your
Yeah.
teeth are so g" even a greyhound, which is I did greyhound rescue, those dogs,
They're
most
they're tough.
animals on the planet, yeah.
They're tough. I had a friend that switched over. I won't name the brand of food, but I had him, gently switch over to a raw diet because he sent me a photo of the dog's teeth, and I was like, "She's only 5, like, holy
Yeah.
moly, this is not good." And when she switched over, he sent me a photo a few weeks ago, and I was in like, instantly impressed because I could not believe how good the teeth looked, and I was like, what'd you do? Did you get a cleaning?" He's like, "No, I just followed this recipe you, like, told me to go on and follow," and I said, "That's pretty impressive." So
Uh,
that's really
Yeah, and a natural way to do it, right?
yeah.
I had one case in Edmonton. It was an abuse case, actually. The dog was a very old basset hound, and Edmonton's quite cold in the winter, like -30.
Mhm.
Had been chained outside. It's kind of a sad story, but it's a happy ending, so I'll tell it. And he was frozen,
No.
froze, and so that neighbors got him and brought him in, and his mouth was, like, green, like the color of my sweater, and it was one of those moments where I was like, you can't breathe, like, you're a vet, I smell bad stuff, but I was, like, really gagging, it was bad, and they said, "Can we need a dental." I was like, let's just try the
Mhm.
food. They put him on raw, they were raw feeders, and he came back. I said, "We'll see what's going on in a month." And they came back in a month, and the toast I wish I'd taken a photo. I was, like, converted on the spot to raw food,
Yeah, that's
you
so
know?
amazing. So
Yeah.
when when we get into thinking about heart disease, what are some of the signs that owners can look for? So first off, how should they start? How should people start with, treating their dogs right, species appropriate feeding, etc. But also, what are some of the telltale signs that you
Well, yeah, so just to narrow that a bit, we are trained as veterinarians to understand who's predisposed. So it's
right?
a any dog can get heart disease,
Mhm.
but there are predisposed breeds, okay? Giant breeds, Dobermans, then we
Mhm.
have the small breeds, so different kinds of heart disease. But
Mhm.
for those, we're trained to kind of give that talk with the puppy talk or whenever they're rescued or whatever it is, you adopt. So we wanna be as proactive as possible with those pets, but
Mhm.
as far as, like, you're asking about early detection?
Yeah, more so early detection. So when I figured out that the little beagle had heart disease, I thought, "Whoa, she's retaining a lot of moisture. Like, what is this? What's going on?" And I ended up bringing her in, and then we did, all of the workups, and that they told we took films and whatnot, and then they told me, and I thought that's very interesting because before he had just taken her hunting like 3 days before, and she was fine. Just he had said to me, she's kind of slowing down and she's coughing,
Mm.
and so and no, so I was like, oh, okay. So now I'm always hyper vigilant with like our older rescue dogs that we have.
Yeah. Yeah. I
So that's
mean,
why I was curious.
generally, a vet should be checking the heart and the
Yeah.
valves every annual exam, which is really important. And we do one of the AI perks, and I don't know if people have heard about this yet. It's all over my feed. Is new stethoscopes that have AI. So they're going to show the owner the heart rate. They're going to tell comes up with the murmur on the stethoscope, like on the circle. You can see grade 2 murmur.
Oh.
One of the things I would say is really important when you get something like that is not, we were taught just wait until they're clinical signs. We
Mhm.
do not want to wait until we are coughing or we're tired, or we want to be proactive. There's so much you can add in that is safe and effective as soon as you have them.
Okay. So
Yeah.
I had an American Eskimo, small mini American Eskimo, and as a puppy, this was like I was I got him when I was 18 and did his annual, and they said he had a murmur. And I said, "Okay, what does that mean?" And they said he's going to develop a cough later on in life, and then he'll probably like develop heart disease and large heart. And I was like, "Okay." So, I go on with life, pre-vet, all that stuff. And he obviously ate kibble because that's what I was told to feed at the time, but he also got fresh food because of hunting, etc. He got some glandulars, and he just passed away last year, and he was
Mhm.
18. And he was still like kicking, but he was old and he was confused. I'm like, "All right, buddy, are you telling me it's time?" And we made the call, but I was like, "Wow, he lived to 18," and I tried to do the best I could for him, but will always remember that talk on them saying, "Oh, he has a murmur, he'll develop a cough," and et cetera, et
Yeah.
cetera. But they
Yeah.
never told me what to do to be proactive.
Yeah. So I think that one is a little different. So
Mhm,
the murmurs, just to like go over that, I'm gonna
mhm.
let Steve talk in a minute about what to do. But murmur just set up just like us. So
Okay.
they're rated on a 1 through 6, just like people. 40% of women, 40% of us have a grade 1 murmur. This is called an innocent murmur. And this is
Mm,
a murmur that is just the sound of our valves not closing 100%. My mother has it. She's over 90 years old. She's doing great. She's had it her whole life. She's a perfect example. So some animals will have a murmur. Many puppies have murmurs because they're a little anemic to start with, and it's that the blood is like more watery, and and they outgrow it or they don't. So if your dog does have a murmur young, there are supplements and things you can do, but it's not until it may never change. Or
mhm.
all of a sudden when they're 12, it goes through grade 3, 4. That's significant,
Right.
so you always understand. I have actually trained people to use a stethoscope. With these new AI stethoscopes, I think people are gonna be able to see, like, the stethoscope's almost interpreting for them, and
Mhm.
that is gonna empower people to look and have not a diagnosis, but a tool to be like, "Now I need to go to the vet."
Yeah.
It's not taking it from the vet, it's just being way more proactive. And then, there are things you can do. So some great things that we most veterinarians hopefully are doing.
Just, yeah, there's several over-the-counter things that people can get that they don't have to sit there and wait for the veterinarian to decide your dog is sick enough to put them on vet med or
Yeah.
something. Is one other kind of hallmark that I would say should, if they aren't routinely going to the veterinarian, as Karen is saying, you should do that, if only to just have somebody listen. But let's say they're not doing that. And we don't want the situation to get to where it got to with your dog, where they go from "I'm fine" to "I'm coughing."
Mm.
Where is there something in between? For a lot of dogs, not necessarily yours, but a lot of dogs, something that happens on the way is they gain a lot of weight. So this is definitely a function of kibble. So, and a veterinarian might explain that as, oh, well, their heart's having to work harder. That's not why it's happening. The reason the heart is degenerating is because of this vessel narrowing, and one of the main the same food dynamics that produce the narrowing produce this propensity to weight gain. So it's the food that's the issue. It's not the heart having to lug an extra 10 pounds around. So definitely the first thing that people should do is to feed a real food diet, a real food, meat and vegetable diet. Uh, I don't necessarily think that it's healthy for all animals to have almost like no plant material in their diets. I
Mhm.
think some plant material needs to be there for some very good reasons that have to do with the microbiome, but that's the first thing. Then what can you find? So what let's say that let's say you're in that situation. Your veterinarian's heard a bit of a murmur, maybe just a grade 2 murmur. They have the lowest classification of heart disease. What is that, B1 or something by that modern classification schema? And or they're carrying a little bit extra weight. What can you do? So there are several things you can get over the counter. I'll mention a couple of them.
I can do that one.
Florence got some info. You're a
Same.
Western herbalist. So let's start with a Western herbal
Yeah.
formula called
Mhm.
hawthorn. Uh,
Hawthorn. Love hawthorn.
Yes. So hawthorn is a great plant to get your animal started on when they have heart disease. From a symptomatic perspective, we don't necessarily, we talked about how important it is for an animal or a herbal formula or a herb to be kind of energetically matched to a patient and then biomedically attached to a patient or matched to a patient. Hawthorn doesn't really have those kind of restrictions on it. It's just it's food-like enough that it can benefit almost everybody. And it does help to counter this endothelial dysfunction, this constriction of the blood supply, not just the rest of the body, but also to the heart muscle itself. The other thing it does is we're going to circle back to this with another treatment in a second, but one of the things it does is it's a calcineurin inhibitor. So that's another thing that vets should know about. It's in the research, they don't know about it. Calcineurin is the compound that causes the heart to basically get all flabby and dilated. So the heart basically gets all baggy because of the action of this enzyme, calcineurin. Anything that's a calcineurin inhibitor stops that process, at which point the heart starts to just accumulate or go back to its normal shape that it
Mhm.
always used to be in without the influence of this calcineurin floating around. Hawthorn is one calcineurin inhibitor. There's another one that's probably even more powerful, but it's one good reason to use it.
I think sometimes people will ask, like often, we have this Ask Dr. Steve Facebook page. It's free
Yeah.
just for anyone out there. It is free. It's got a vast library we've been working on for years
Mhm.
of cases that people can just join for free. They can use a little search icon and look up cardiac disease.
Mhm.
There are often questions about Hawthorne because there's some literature saying, oh, it doesn't play well with the drugs.
Right.
You often have to lower your drugs when you're on it. That's what they're saying. Like it can drop the blood pressure, right? Because,
Mhm.
and that's not a bad thing. That just means it's working. So you
Mhm.
need to not overdose on drugs. With heart disease, I would like to emphasize
Right.
you cannot stop drugs just because you stopped herbs. You often can get way lower doses, and we're going to talk about that, especially with the most common problem, which is fluid in the chest, pulmonary
Mhm.
that, those water pillar and this applies for humans too, right? People take Hawthorne.
Oh, yeah.
Yeah.
Yeah. Oh, yeah.
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 Super safe.
And I should point out, just on the hawthorn question,
Mhm.
and I've looked into, okay, is it really not a safe plant for certain situations? When I have delved into massive numbers of studies, like
Mhm.
hundreds of studies, the claims that are out there that hawthorn is somehow dangerous if you combine it with pimabendin, et cetera, it's just
Mhm.
not true. There's actually no risk in using hawthorn. That's the conclusion of, multiple systematic reviews of the plants used in heart disease. There's
Yeah.
no reason not to use it.
It's kind of like being a quack makes you spend a lot of time on PubMed.
Yeah, I never
It
read
Oh,
I
never
I
read so
spend
much research as when I became a quack.
I spend so much time on PubMed because like I said, I used to treat humans, and the only herb that I really caution against is reishi if someone's on a blood thinner, and that's, you
Mm.
know, really
mhm.
That's really the only
Okay.
one I could think of,
Well,
but very
yeah, so Hawthorne's great. Hawthorne will also show up in a lot of good over-the-counter supplements. I do not work for any of these companies. I don't get a throwback, but there is a company called Fera, Fera, and they make a cardiac support that does have a good amount of Hawthorne, and people my patients who have taken it, like, I've noticed over the decades seem to do well. One of the things in it is CoQ10. So
Mhm,
CoQ10 is a great thing to give. First of all, you can't give too much. You just have
mhm.
excessive pee. Like if you're like, oh my God, I gave 100 milligrams, doesn't matter. It's going to go right through because CoQ10's, it's an enzyme in your myocardium. So that's your heart muscle, and inside, if everyone can remember high school biology, there's the mitochondria. He's like powerhouse guy. And he's like, yeah,
I just thought of a new costume.
Yes, yes.
mitochondria, as I call him, or the mitochondria. He's full of CoQ10 that helps this cells in our bodies stay healthy. So it's like super concentrating your heart muscle. And
Mhm.
they have found in dogs with heart disease and heart muscle changes that the coenzyme Q10 is too low. So of course we want to give that. Of course we do. And it's an antioxidant. And when I did my research, I lectured on this. I've lectured a few times. Jennifer Aniston always comes up. She takes it every day. And I'll tell you, that's inspirational because we're the same age.
I I take
And,
CoQ10 too, so
well, look at you.
I
Look at
like
Tell us you're 62.
No, not yet. No, but I
Yeah,
also
yeah.
have a couple dogs
That's
on
him.
CoQ10.
No, but I mean, it is such a simple thing and definitely should be used. There is, again, proactive any Great Dane,
Mhm,
any Doberman, any Spaniel, teacup. There is no reason for these animals not to be on CoQ10 and people always want to know. And I want to not just be like, this is your vaccine schedule or
right.
this is what is it that makes this dog special? Even the American Veterinary Medical Association, the AVMA, which is a very kind of old school, straight and narrow. They really encourage veterinarians to go in when they're puppies. They don't say you spay at this age and you do this. They say look at each individual. And that's really important with heart disease, super important with heart disease.
Yeah,
That you're identifying what can we do now? What's going to be just something that's so customized that will help now? Because the earlier you catch something, the better.
yeah. And with CoQ10, there's so many brands out there now that are, like, pretty good brands, so it's not like it's going to be difficult for someone to
Mm.
purchase. They don't have to go to their vet and actually purchase the CoQ10, correct?
No,
Other
yeah.
Yeah.
We carried the 30 milligram one, really tinies, but since that, over the decades, we learn not everything we did at first. And
Mhm.
so Dr. Judy Morgan, she's got King Cavaliers
Yeah.
and heart disease. And she, I had a nice conversation with her and she was saying she gives, like 100 milligrams to them. And
Wow.
technically published is lower than that. But again,
Uh,
worst case, they're peeing it out. And so also any CoQ10 is fine. Just obviously no like synthetic sweeteners,
mm,
dextrin or whatever, you know what I'm
mhm.
saying? Like none
Yeah,
of the stuff.
Yeah.
just
No
the yeah.
flavored.
Yep.
Yeah. Now, if
Yeah.
you wait and decide, I'm going to go and talk to my vet about this,
Mhm.
ironically, veterinarians are told, "Oh, we're not sure the CoQ10 works," which is a ridiculous statement
Mm.
because the only reason anyone's heart is beating is because of CoQ10. It's
Yeah.
how you generate ATP.
Yeah.
It's how you generate the energy for a heartbeat. Your body is filled with CoQ10. We're just talking about giving some more because it needs
Mhm.
to be topped up. The other,
That's changing though. But it's true 10 years ago. I
no,
think
I
it is changing. No, it's not
I'm
changing.
thinking even a year or two ago, you'll find cardiologists saying, we don't think that necessarily, or there's no evidence. Of
Yeah.
course, there's evidence. Your heart is full of it. They're full of it. Then there's the other thing that helps them, the heart just kind of manufacture energy is
Mhm.
taurine, which the
Okay.
amino acid taurine. Basically, you can look at if you look at CoQ10 as like the the thing that basically accepts food into the walls of the mitochondria and makes ATP out of it. You can look at taurine as the compound that opens the door to allow those nutrients into the mitochondria.
Can I tell my taurine story?
Tell your
It's a good story. So I had this client this is probably like 10 years ago. She came in and she's making her own food. And I was like, that's great. And she goes, I'm just having some problems, doctor. I'm having a really hard time sourcing the eyeballs. The eyeballs. And I'm like, what is happening? She's like, yeah, I found online, Dr. Google, that I could only get taurine in the eyeballs. And this is I'm having a hard time. Like I've been calling the stockyards trying to eyeballs. I was like, well, there is useful information online, but you just need to be careful because taurine is in muscle meat, muscle, which is what most meat is,
Mhm.
muscle. So if anyone out there read that article from Dr. Google that you needed eyeballs in your food, really just eyeballs in your head are fine. Don't eat them. You just can have the muscle. But
or
I found that really interesting for multiple reasons. One, I
Yeah.
was so off base, but she was trying. So yet
Yeah,
again,
he was trying, but she had misinformation. Gosh, trying to source eyeballs, that's, like,
yeah,
really
yeah. Plus, you got your little cauldron bubbling. Where's my
yeah,
eye?
like, where's the eyeballs? The jar of eyeballs, like, oh, yeah, the
Uh,
imagery.
the
That's
dog
that was
spits
an
it.
that was an interesting bowl.
is one other kind of big thing that people can get over the counter that we did have a hand in developing that will stop should slow down this progression. So once you hear the murmur, you know that wheels are in motion. You know you got to kind of dilate these blood vessels. You got to kind of hinder the heart muscle from getting too flabby by inhibiting that enzyme, that calcineurin. So there's we developed it for allergies, but it has the benefits of treating heart issues. And
Mhm.
that's a compound called Cessorex from Gold Standard Herbs. So it's
Mm.
spelled Cessorex. We can send you a link or an image or something
Oh,
if
yeah,
if
please
you
do.
don't know what we're talking about. So, and as a Chinese herbalist, you'll appreciate what's in it. It's very basic. It is about half minor bupleurum and about half something called four materials combination. So each of them does something slightly different. The four materials combination, that's like the quintessential blood tonic slash blood mover of Chinese medicine. It features in many formulas that have to do with circulation, and it directly counters this squishing of of the blood vessels, this constriction of the blood vessels. Myoperium,
Mhm.
some of your audience might know it by now, hopefully, as an immune modulator, like an immune regulator, like it somehow protects the immune system. It doesn't suppress it, but it normalizes it. One of the ways it does that is by inhibiting calcineurin, because the other thing that calcineurin does, besides remodel your heart, is it is a function of allergies and autoimmune disease and an overactive immune system. So that's why we use the same formula to treat extreme allergies.
Yeah.
And also we use it to treat and stop the progression of heart disease. And especially in those early stages, if you did these, the Cesarex,
Mhm.
taurine, hawthorn, and CoQ10 and then normalize the diet, I wouldn't be surprised if the heart murmur just disappeared and everything just went back to normal. So
That's a really good one, yeah, and you notice Steve's mentioning, like, with the gold standard herbs, that company
Mhm.
came about during COVID when we were trying to help the humane societies in San Diego and Southern California. So many animals that had issues, especially geriatric animals who often have heart disease, trying to find a safe way to use things we'd used for decades that we knew were really safe and balanced and effective
Mhm.
that people could get over the counter. So
Love that.
veterinarians can sell it too, but again, trying to bridge that gap to get out to the hundreds of thousands of animals that don't have veterinary care. To move on from Cesrex, which is so good, the most common thing that happens with drugs once they go in, and you mentioned the cough, and the cough is one of the most common reasons people would bring the animal into the vet, especially if they haven't had access to a vet or they've got to drive a couple hours to the vet. The cough is coming from pressures changing from heart disease and fluid gets in your lungs. And this is called pulmonary, meaning your lungs, edema, meaning fluid. And so this happens in people, and we go on the water pill. That's Lasix, or its drug
Mhm.
name is furosemide. Many people watching this probably have an animal on a diuretic. So one of the most popular plants ever used. Like if you ask an herbalist in North America or Europe or China, even Chinese medicine, Western, if you could only use one plant in your practice, they will say, and they've done studies on this, dandelion.
Yeah, yeah, of course.
Dandelion is amazing. It has two parts of the plant. You have the flowery aerial part and you have the roots. The root of dandelion is really good for liver disease. It's a detoxer. But the aerial or leaves of dandelion, it's really important people understand the difference because when you're supplementing dandelion for heart disease, you want the whole plant or just the leaves. The aerial part is a potassium sparing loop diuretic. So Lasix, the water pills, they are a loop diuretic. That means that in the part of your kidney has little loops. That's where the water goes out, but it doesn't spare potassium. So with kidney disease, it's really tricky when the vet's trying to like pull the fluid off and
Mhm.
protect the kidneys. It's really, really hard conventionally because you need the animal to breathe. But now the kidneys are getting really hammered.
Mhm.
But if you use dandelion, you can decrease Lasix or even go off it sometimes, but at least way lower than I used to use. And your dandelion is really high in potassium and it spares it. So you have all these benefits and there was no reason. And people are always like, well, what kind do I use and how much do I use? I had a patient, he had he had been put on home arrest. So I only did house calls for 2 years. And he was given like 3 weeks to live and he lived years. But the owner said he didn't like the non-alcohol tincture.
Mm,
She had a hard time pilling him. He had bad teeth. So she like went and bought dandelion tea, like the
mhm.
leaves, and she'd steep it for like 7 minutes and she'd make this and she put it on his food and it worked. Do I
Mm,
know what the milligram dose was? No. Was I comfortable with this? Not at all. But it was, and so I just want to say, if you're just
yeah,
like, oh, I have the tea, sure,
yeah,
just steep the heck out of it and
yeah.
put it in food because it is such an amazing plant. So dandelion leaf is just the second anybody has any edema. I don't care if the Lasix
Mhm.
controlled it. You got to start that. And the
Yeah,
whole plant's great because then you help your liver too, which, why not? Any
yeah.
two things about that?
Yeah, it's the only thing I would add is that if people put ground up dried dandelion in food, it doesn't seem to work. It
Mhm.
needs
Right.
to be like a liquid version. So the tea sounds like an awesome idea. The other thing that can be really helpful is just, even alcohol extracts are fine or glycerin extract is fine. Generally, we, as a very rough guide, will dose like zero point 0.2 mils of
Mhm.
a tincture per 5 pounds of weight. So if a dog is 20 pounds, give them close to a mil, which is close to about 30 drops a couple
Mhm.
times a day.
A lot.
Start there and then
And they're
go down.
often around 1,000 milligrams of milk.
Yeah, yeah.
Yeah.
I do
But
drop.
it's like worst
Yeah.
case, your dog is peeing, then I would back off on the drug a little bit,
Mm,
but always talk to your vet. Always talk to your vet, have them take a listen. I often would teach people how to listen for the crackles because the
mm.
crackles are really easy to hear. You should not hear air in lungs, but when you can hear liquid in
Yeah,
lungs, generally, and then you talk to your vet.
you definitely can. I I love dandelion. Herbs are so amazing. I geek out on herbs. I get so excited when they work too. So, okay, so dandelion's another one. So we have CoQ10, taurine, dandelion, and then you said you had another?
So
It's
that
Sesrex.
the
Oh,
Sesame
that's right. That's right.
yeah. And then if we're kind of our patient is progressing and they're coughing, we know there's food in the lungs, so we're gonna start our dandelion. What else can you do? So then we can kind of up our game with the Chinese herbs a little bit. So one of the things that you can do is you can take Cesarex is just a combination of two formulas where you could essentially say, all right, I'm now going to take the one half of Cesarex and give a full dose of it. I would take the other half of Cesarex and give a full dose of it. So the one half of Cesarex was this minor bupleurum. That's the thing that inhibits this distortion of the heart. It also helps, it's a bronchodilator, and it also counters this tendency for the vessels to constrict. Respect.
Mhm.
So this will tie into what Karin's going to talk about, which is that from a Chinese medical point of view, what is the problem with animals with heart disease? from a Chinese point of view, we have all sorts of heart formulas. And so you think, oh, so those are the formulas I should use for my dog in congestive heart failure. Almost never. The formulas that are most apropos from their symptom and Chinese medical action perspective are those that liberate peripheral circulation. It really does tell us that even from this Chinese medical perspective, this vessel constriction, this inability to move blood out to the periphery, that's the big problem, not treating the heart per se. So minor papillary is like has this overarching control on peripheral circulation. Blood essentially gets pushed by yang energy. And minor bupleurum is all about the normalization of the flow of yang energy. So it's a really important part of encouraging peripheral flow. There's two other parts. One of them, I'm just setting Karn up here. Chinese medicine certainly saw that, okay, all this circulation seems to emanate from the chest. That's where all our acupuncture channels start. So when we have blood stasis in the chest, when there's stagnant blood in the chest, when we're not having good peripheral circulation. So that's one problem. There's a formula for that. We're going to get to it. But then you also have to get your qi and blood to your chest to circulate. That is another huge problem that has been ignored really until late. I've only just started teaching veterinarians about it on the strength of what Karin has figured out. And Karin has figured it out through her patients, one of which is the famed Alabama.
Yeah, I like to talk about cases because, even as a vet, I will just start droning off if people get too scientific. It's so sad. But
Comment? Is that a comment?
so I can send you a picture of Alabama too if you want.
Yeah.
But one of my patients, Alabama, but she's like another. I had a couple lately. The other one's olive oil, like she's a little Chihuahua olive oil from Popeye.
Sure.
Yeah, they're both very similar. So much older pets. We're talking 15.
Wow.
Alabama was about 40 pounds, so a bigger dog to be 15. But from age 12, for the last 3 years, heart disease has started. And one thing that you can do, I like to empower owners because you're at home. And I know people can say yes or no to this, but some people do like to learn how to use a stethoscope. And one thing you can even do when you have an advanced murmur is just use your hand. So you can hear the heartbeat with your hand in a grade 4 or 5 murmur, definitely in a 6. And then you need to check the femoral pulse. So a veterinarian should not just be listening to the chest, but they should be checking the inner thigh of the dog on the femoral artery, that pulse matches the heart. They're both going together. When you have what's called qi deficiency in Chinese medicine, where there's just not enough energy, and the dog is old and they're tired and they might be wobbly, or they fall over and pass out from syncope, which is passing out from heart disease, like or a seizure from heart disease, where you miss your beat, you don't get the blood. You feel that when you're checking the pulse. So veterinarian should be listening to the heart and checking the pulse. People can do this at home, especially if you have a 5-6 murmur, your vet has shown you how to feel it. You can feel the thrill. It's because the blood's not going boom, boom out. It's going through these valves. And then you want to feel that you can have your vet show you where that pulse is. But if the arrhythmia is like that, or they've heard an arrhythmia, it's really simple. I just tell people, your body, the dog's heart doesn't have enough energy to even beat like that. So, of course, incontinence gets worse.
Yeah.
Their arthritis in their back, which they have, is worse. They're stiff, they're weak. It's a time where people start evaluating quality of life. So, the formula that we use, and now there's an over-the-counter version, is called Galvanex, like to galvanize. That is basically a very, very old herbal formula. In Chinese, it's Bu Jiang Yi Qi Tong. Lift the qi. Lift the qi.
Lift the chi. Okay.
Huge formula for women. Originally, women were just so depleted after having children, like a childbirth formula, you just like cannot even keep your resources in your body. You're a mess. This is full of ginseng. It's like such an easy thing to remember. And ginseng with these other herbs helps your adrenal glands, which are huge, especially most of our pets are spayed.
Mhm.
Different podcast for me to talk about estrogen.
Yeah. Uh-huh.
But making choices on if we're going to take ovaries or we're not going to take ovaries.
Yeah.
But the ovaries are gone. So everything's on the adrenal glands. They're the only other part in your body that's making any kind of estrogens. Now you're really old. So Bujang Ichitong or Lift the Chi or Galvanex. Galvanex is the
I'm
skip.
familiar with Galvanex.
It's all the same kind of formula. It's really great at dealing with arrhythmia. So, Alabama was starting to fall over, especially when she would poop. She'd go to have a bowel movement. It's too much in Chinese medicine, the down-bearing energy. I guess in any kind of medicine, it's a
Yeah.
down-bearing. And it would just take her out. She'd just pass
Wow.
out, fall over in the bushes, So within a couple of days of being on that, the owner was sending me videos of her like prancing down the street and not falling over and whatever. And so that was just a huge discovery and win because is it a cardiac formula? No.
No,
It's
but
technically on paper, it's a
And
postpartum for women formula, but
yeah.
it has all the things that improve that circulation. Steve's gonna tell you exactly why. I'm just like, "It's awesome," and he's
It's
gonna
amazing.
because and same I put the same thing, olive oil, just tiny little chihuahua,
Mhm.
would fall over and
Yeah.
it's just amazing. It's such a integral part. So once I feel a disconnect with the pulses or they're choppy or they just amplitudes are different and it's
Mhm.
like a jazz band when you're listening to the heart, that I always go to that and again safe with everything else.
Okay. Yeah, that's
yeah,
great information.
the ginseng component is really key.
Yeah.
Because it, as Karen is saying, for tachyarrhythmias, like really rapid heart rates that are kind of resulting in these drop beats, etc., the pulse deficits,
Mhm.
they it slows those down. It is also a calcineurin inhibitor, so
Mm.
it stops the heart from getting distorted in shape. And from a Chinese point of view, like I said, it delivers to the chest, so you have some oomph to then peripherally circulate your blood. So it's part of that picture. And then the other component to that, we said, okay, we need to unleash the hounds and basically open the gates to allow yang energy to move blood out. Great. We need to have stuff in our chest to be able to move, like some power there. Great. The final thing is we just need a blood mover. So to kind of just kick it on its way. So that's the final formula is it's the Chinese name is Shui Fu Zhu Yutong, but it basically is Persica and Carthamus combination, or it's several of the compounds that are in Cesarex are in that formula, which is why people can start with Cesarex and they may not need that other one. It translates to blood's palace or dispel stasis in the palace of blood. So Con Essentials, a Chinese herb company,
Yeah.
blood's
Mhm.
palace or dispel stasis in the palace of blood. Either of those will work. So that's when your dog is coughing and say, okay, we need to up our game.
Mhm.
Then we introduce the Galvanex. You can keep going with a version of myoproplurum, whether it's Cesarex or
Mhm.
Voltrex or Harmonize the Chi or myoproplurum, whatever. If you're using myoproplurum though, and you're going to use a company's formula, make sure it's got ginseng in it, because that's where a lot of that interference with heart distortion comes from.
We do like with the telehealth, we are mentioning certain companies just because
Yeah.
We
we
want
know that you can have the same name, but different
people
stuff in it.
people will
And I
sometimes
think
try and cheap out on
Mhm.
the ingredients,
Yeah.
Yep.
and if you do that, then you're not going to see the
These are the
benefits.
ones that have the right ratios for pets.
Yeah. I've
Mhm.
seen that happen before. I actually had a client and they had purchased a Chinese formula that was recommended and they purchased it on Amazon. And I was like, this it has the same name, but it doesn't have the same ingredients. So I had
Yeah.
recommended them to the con.
One does have a store on Amazon.
Okay.
Okay.
Store,
No.
right. Yeah.
Yeah,
I think
because they are.
sometimes some other people try to I don't know if they're considered resellers or they just like I don't know, but I always try to
Yeah.
go to the source.
I don't think
Yeah.
Khan says they have any official resellers on Amazon, but they
Okay.
are all ones saying, yeah, the only legit version is ours.
But if
So
same thing though, if you don't get it from
Yeah,
a connoisseur, it's somebody who's not endorsed.
correct. Yeah.
I have had people bring in, say, like Blood's Palace, Con
Mhm.
Essential that I have, and then they bring in the one they got, and the font is slightly different.
It's different.
Mm,
Gotta
yeah,
watch out. Well,
I
Yeah.
know.
it's
So that's
tough.
a lot of formulas,
Yeah.
but they we do find that almost all cases of heart disease respond to that. It would be that a minority, probably less than 10% of cases that
Mhm.
wouldn't really necessarily they would need something different.
Yeah.
So in all those situations, then it seems the main way to support your dog's heart, apart from inhibiting this calcineurin, is to just look after peripheral circulation. And of that, diet is by far the most
Oh,
important
and
thing.
in the diet, the other big question we get is, well, is it just like any other raw diet or any other cooked diet? You can actually feed vegetables that are high in nitrates. And that will be the nitrates mix with your bacteria in your mouth,
Yeah.
and they go on to make that nitric oxide that helps
Yeah.
your vessels. So examples of they're often leafy greens, spinach, huge in nitrates. So that's kinda easy to blend into food,
Yeah.
especially if you puree it if and what do they say, like, wok it or arugula, uh,
Yeah, like
Basically,
pocket. Yeah.
leafy greens, beet
Yeah.
greens, all are a way to customize your pet's food to just help those vessels, and that's a really neat party trick too.
Yeah, that is I I love that because as you stated before, I want pet parents to feel empowered to try to do these things. And a lot of people that I end up speaking with that are new to the fresh feeding game, they're so overwhelmed. They're like, "Well,
Mhm.
my vet shamed me because I said I wanted to try a different diet, and they're telling me that I have to feed this because it's veterinary formulated." And I'm like, "It's not." But and
It's
then they're
hard
like,
because
"Yeah,
yeah, so this has been a thing for me. I went to
yeah,
Tufts University in Boston. I will shout out to my veterinary school, required to cook before you graduated. Not only did you know how to feed a horse and a
yeah,
cow, which truly for a Bostonian is not really, but you had to be able to cook a balanced recipe for
mhm,
small animals. And God bless them, I came out and I was like, everyone's gonna cook. That did not happen at all to where I landed in my first practice. So I would tell people to add real food on. But
mhm."
more and more, where do they think veterinary food comes from? It comes from real food. It just gets
Right.
processed and processed and processed. So I
Yes.
do feel like
if they're lucky, it comes
things
from
like I am an optimist. So I see Just Food for Dogs coming
Mhm.
out of, Davis, which is
Yep.
a great vet school.
Yeah, dude. That's
They
great.
are making real food, and if Just Food for Dogs can exist, then any veterinarian should understand that
Mhm.
real food is okay as long as it's balanced. And in fairness, it's when people don't balance foods or like a breeder, it's
Yes.
this famous case. It's so old now, but it was a breeder in Canada, I think in Eastern Canada, had Great Danes and wasn't putting calcium in. The
Oh,
dog at the vet school with all these
oh,
deformities of their limbs. It was heartbreaking because the breeder didn't have the right calcium phosphorus ratio. It is incredibly important. If you don't
mhm.
give someone calcium, they're going to pull it off their bones. We know this, any mammal. But that
Yeah.
was one breeder a long time ago. But it put the fear of God into veterinarians. So
It
if you could just gently and with a lot of honey say to your vet,
Mhm.
"I'm a cook. I know you guys learned about it in vet
Yeah.
school. Do you have some resources for me?"
Yeah.
I, they're going to have to step up.
Yeah. I think that a lot of people that I speak to, it's not even their vet being concerned about I've had people say, "Oh, my vet's concerned about salmonella," but it's actually not that. It is about the formula being balanced. And I
It's all
think
balanced.
and I see is vets are saying, "Hey, okay, that's great that you're trying to do this, but you're not doing it correctly. You can't just throw a couple things in with rice and etcetera and think that it's complete imbalance. Like you need other things." And so
It's so easy. I mean, there's like balance it is
yeah,
a thing that I've seen many vets in practice use. And when I was medical director in a veterinary hospital for throughout COVID in San Diego, and I would just have the other vets. I'm like, if they want to home cook, just use that balance. They just
yeah,
all use it. There are other really, really fantastic ones like the animal diet formulator that
love,
good Barbara.
yep, and Steve
Yeah.
Brown.
Yeah, just
Yeah,
fantastic.
great. Yeah.
But it's not that hard because there's so many balanced supplement bags sold. Like this is what you do. You put the powder in with
Yeah.
meat, vegetables,
Yep.
you know. There's so many options now that it's not just like somebody walking in with their moose.
That's so great. And I can totally picture that in Canada, just like somebody coming in with their food.
You're gonna be feeding that for a while.
So when I first moved here, it was venison. And like I said, my husband's a hunter. Everybody here, they hunt. And when Brian first hired me, he's like, "Well, what do your dogs eat?" And I said, "Oh, right now, like currently they're on venison and other stuff." And he was like, "Venison? Isn't that considered hot in traditional Chinese medicine? Are your dogs a mess?" And I was like, "Well, no, actually they're doing quite like well on it, but I don't feed it 24/7. Like I would rotate it." But I remember the first time someone was like, "I have a bag of venison." And I was like, "Oh my, that's a lot of different parts in there."
Yeah,
So
yeah.
I can picture the moose. Well, thank you. This was a lot of amazing information, and I can't wait to put the links in the description. You said that you had, those recommendations. We can put it in the description. And then I'm a part of your Facebook group.
Oh.
Yeah, I think I stumbled upon it like a couple years ago, and that's actually I use it a lot when I have live chat questions that are, like, a little more in depth and I don't have the time to, like, hop on PubMed. I will actually go to your Facebook group, and I have, researched, like, some rare cancers and some heart disease issues and stuff
Oh,
like that,
good.
and read some,
That
like, case studies.
that's
So,
awesome. That was the goal.
yeah,
Our
it's a powerful
our
tool.
our veterinary friends and our family are always like, "You guys, that is a lot of work for
It is
free."
work.
Like, no, hopefully
I
it will
commend
stand
you
the
guys
test.
because it is a lot of work. Because I do try to keep up with the posts on there and read them, and I'm like, "Whoo."
The great news is that we're on the verge of, you have to search through there and then you're like scrolling through cases. Does this apply to
Mhm.
me? You think, well, I'll ask a question, but then it seems to take us forever to kind of get to your question because there's just so many.
Yeah.
So what we created now is this AI version of us.
Mhm.
Librarian of all the things that
Yeah.
he ever wrote, all the books, the papers, the lectures, and
Fantastic.
it is all that librarian.
So we spent the last 3 years training it. We didn't just kind of like, we've been coaching it on answers.
Uh-huh.
Lena Wang, who's the administrator of our Facebook group, she's been training this AI version, and then we periodically test it, a couple times a week just to see what the quality of answers is. She's got 1,000, I kid you not, 1,000 different instructions to kind of get it to speak properly and give the
Yeah.
answers. So we're into our fourth test version of that. I think it's going pretty well. So I
Yeah.
feel like within the next month or two, it's going to be
Mhm.
something that people will finally be able to access. They won't have to search through Facebook. They
And it doesn't take from the internet. It's not
No,
taking from other, it's literally
just
Yeah, it's
just
you.
and we
It's your
personally
knowledge.
train.
Yeah.
wow.
That's very empowering because another thing I run into with clients is I've been told multiple times that they feel like they're being priced out of feeding their dogs
Yeah,
well. They're being priced out of information. They're like, every time I go to the vet, I'm having to spend this amount of money and then I have to buy like 3 different, medications and I'm so confused and blah 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 and
yeah,
I try my best to educate because I'm like, knowledge is power. And always
Yeah.
talk to your vet. I try to work in conjunction with, the client's vets. I'm like, I'm happy to talk to your vet. And I've never had a problem. Like it's always been a great team. But I do feel that people are craving knowledge and they want that. So that's
and
really
it's knowledge that their veterinarian doesn't even necessarily have.
great.
Because it's
Right.
not that it doesn't exist. You could go on after this little podcast and type in calcineurin heart
Mhm.
disease in PubMed, and you will find articles talking about how if
Yeah.
you hit that enzyme, the heart returns to a normal shape. It's been done over and over and over again. It's not wacky science.
Mhm.
It's established, but the
Yeah.
veterinarians have never heard of it because there's no drug that does that.
Right.
So
Exactly.
you know, unfortunately, modern medicine is as much a business model as it is all about, increasing health. If it was
Yeah.
about increasing health, veterinarians would be behind real food diets.
Mhm.
It's, it's as much about business, unfortunately.
Yeah. No,
So we're right
completely.
there with you. We feel like there should be more stuff that's inexpensive, more stuff that's free. We want the public to actually pull the veterinarians to where they're at. Instead
Yeah.
of us trying to push veterinarians, we're now
Yeah.
empowering the public to try to pull their veterinarians
Yeah.
by giving them this knowledge, by saying, you need to check this out and see if
That's
we can kind
mhm.
of improve the profession now.
Yeah, I have when I was back in California for a birthday party, I actually met a vet. She's a vet in Santa Barbara, but I think she's originally from Indiana. And she said, "Hey, can I pick your brain a bit on herbs?" And I said, "Sure." She said, "I had a client come in and, ABCD, and they asked me what herbs they could use." And she said, I felt like such an idiot because she said, "I don't recommend because she
Right.
didn't have the
The
knowledge just
knowledge.
to
Yeah.
say, and I said, "Well, I'm happy to, like, look over it and just give you some recommendations, and then you can do your own research," and that's what we did, and I recommended dandelion, and she
You're
was
in good
she
company.
was really happy, like, she's like, "Oh my gosh, now I wanna take an herbal class," and I said, "Yeah, you don't have to learn 20 herbs at once." I said, "Focus on one, learn about that, and then just go from there." So I thought that was, like, pretty,
If
so
there are any vets watching this,
yeah,
just stuff on VIN, like the VIN. That's our veterinary PubMed.
yeah,
Every veterinary office has it. It's international, and you can type these things into VIN, and you will get answers if that's like your go-to at work. Because I will shout out to veterinarians because I have mostly been a practitioner, not an educator. Always on the ground level in the parking lot during COVID, working nonstop. And it's a hard job and we don't have a lot of time to look stuff up. And so the younger vets, they're very scared. They don't have mentorship. They're always going to look up, like, is that safe? Is that not? Is that safe? Is that
right,
not? And so if they know they can go to VIN or they can go somewhere very quickly and get a resource, they will be more open to it. It's just like they just do not have time.
yeah,
So kudos to that vet who is like looking what she wants to learn next because you do
mhm,
get to that point, but your first 10 years, you're just like terrified you're going to hurt someone.
I'm sure,
And these vets that graduated during COVID, they
yeah,
did not have what it took. They did not have any mentors. They were solo out there. And yeah, that's again
that's
another topic. But
that's scary,
it is important to have a resource like the librarian where you know it's a vet because there are people on social media who say they're veterinarians and they are not veterinarians. And I just like my mouth went open. I could not believe. But again,
I've
it's the
seen
whole
those.
eyeball thing. When someone comes in your hospital and complains about sourcing eyeballs, you never forget that. So you just want
I'll
to make
never
sure
forget that story.
you're going to get your information.
Yeah,
Essentially, get some eyeballs.
that's so funny. I know, I'll never forget that story, just trying to source out well, thank you again, this has been a wealth of knowledge, and I'm really grateful because I'm all about having a mentor, so I'm gonna absorb
Can't
everything.
get a better mentor.
Me,
I
I
know,
really liked my mentor.
We're the Mutual Mentor Society.
mutual mentors, I love it.